We had an unusual case come to our attention. The patient was a 53-year-old man who presented with chest pain to the ER. On further workup, his CT angiogram showed a right-sided aorta and aortic arch, which is a congenital anomaly and is pretty uncommon. The more concerning finding was the fact that one of his branch vessels to his brain had a comoral diverticulum, which was then ruptured, and it was a contained rupture. So this was a life-threatening emergency. And we thought of both open surgical options and endovascular options. Because of where it was in the arch, it was going to be difficult to get to the affected segment. So what we ended up doing was actually combining two approaches, a traditional open surgical replacement with endovascular techniques in order to perform a hybrid repair for this patient. One of my vascular surgery colleagues, Dr. Andy Houle, started with a neck incision and then a carotid subclavian bypass, which allowed us to control the ruptured subclavian artery from the distal aspect. And then I followed that by doing a sternotomy, placing the patient on cardiopulmonary bypass, cooling the patient, and then using what's called hypothermic circulatory arrest to actually temporarily pause blood flow in the aortic arch. I deployed a endovascular stent from the inside. Actually, we call that the frozen elephant trunk technique. And then we sewed a conventional arch graft to that and reimplanted all the head vessels. And that takes care of the ruptured segment sort of from the inside and then takes care of the rest of the aorta. Then we use cardiopulmonary bypass to rewarm the patient and then close everything up and then bring the patient to the ICU. We were able to reestablish blood flow to all the branch vessels, and we had excluded the ruptured segment, meaning that there was no longer any blood leaking. I don't anticipate that he would need anything in the future. That being said, we have dedicated follow-up. They will routinely get surveillance imaging, typically with a CT angiogram or an MR angiogram. I think this case really nicely highlights the importance of multidisciplinary care. It took a lot of different healthcare providers from different specialties to achieve a successful result. And so I'm really proud of our multidisciplinary team here.